Hello and welcome to the Hospice Education Podcast. Today we're going to be focusing on mouth care at the end of phase of life, an aspect of care that is sometimes underestimated, yet has a profound impact on comfort, dignity and quality of life. While nutrition and hydration are often discussed, oral health can be just as significant, particularly in the last days and weeks of life. I'm joined today by Tracey Proctor, who has extensive experience in palliative and end-of-life care. Together, we're going to be exploring why mouth care matters, who is most at risk, and how thoughtful, evidence-based use of equipment and products can make a real difference. Hi, Tracey.
Hi, Leanne. Thanks for having me. Mouth care is an area of care that I am really passionate about. It really is one of those areas where small actions can have a huge impact, especially when someone is nearing the end of life. And it is one of the most meaningful comfort interventions that we as care providers can offer.
Okay, so let's start with the basics. Why is mouth care so important in end-of-life care?
So mouth care is really important, Leanne. It directly affects comfort, communication, dignity, and symptom control. Poor oral health can cause real pain, dryness, infection. It can cause difficulty speaking, distress, and actually an increased risk of aspiration. In palliative care, where the focus is on comfort rather than cure, mouth care becomes a real core clinical responsibility. Effective mouth care really just supports that comfort and dignity.
Sure. And I guess this links really closely with holistic care.
Yes, absolutely. Oral discomfort doesn't just exist in isolation. An uncomfortable or painful mouth can increase agitation. It can actually reduce social interaction and affect emotional well-being, particularly in those final days of life.
Okay, so which patient groups would we be looking at to be most vulnerable to poor oral health at the end of their life?
Well, there's several patient groups. So individuals who are receiving palliative care are really at higher risk, but this is also compounded by individuals with dementia, frailty, delirium, those with learning disabilities or reduced mobility. And actually those on oxygen therapy or who are receiving chemotherapy or head and neck radiotherapy are also particularly vulnerable. So really, it's just as individuals are becoming increasingly dependent on others for personal care, mouth care often relies entirely on the care staff.
Okay.
If it's not prioritized or if staff actually lack confidence, oral health can deteriorate very quickly.
And in your experience, what mouth problems do staff most commonly come across?
Well, I would say dry mouth is by far the most common. A dry mouth can lead to cracked lips and oral pain, infection, difficulty swallowing, and it can cause real distress. And this can be caused by dehydration, reduced oral intake, medications can cause dry mouth, oxygen therapy, and actually mouth breathing is one of the most common. It's so common at end of life. So providing effective mouth care is vital for comfort and dignity in that dying phase. We also commonly see something called mucositis, which really is just it's painful inflammation of the mucosa, which is the lining in your mouth. If you take your tongue and just feel the inside of your mouth, that is your mucosa.
Okay.
We also see oral candida, which is what we call oral thrush. We might also see thick secretions and halitosis, which is really is just bad breath. Drooling, changes in taste. We could see mouth ulcers and actually issues with dentures, particularly when those dentures are no longer fitting comfortably.
And I can imagine these problems often overlap with each other.
Yeah, they really do. And if they're not identified early, they can really escalate. And that's why regular assessment is so important.
So what I'm gauging here is that assessment really underpins everything, and without regular assessment, it can be easy to miss the changes that can
Yeah.
cause significant discomfort. So, when we're carrying out routine mouth care assessments, what should we actually be looking out for?
I think that's a really important question, Leanne. Mouth care assessment isn't about doing a one-off check. It's about ongoing observation, particularly as someone's condition changes.
Sure.
So at end of life, deterioration can happen quickly. Regular assessment allows us to respond early and adapt care appropriately to that individual.
Okay, so, and it's not just about teeth?
No, not at all. What we're doing, we're looking at the whole oral cavity. So that's including the lips, the tongue, the gums, the teeth, or dentures, the inside of the cheeks, and also the level of moisture that's in the mouth. We're also paying attention to comfort and tolerance. How the person is actually responding to mouth care is just as important as what we can actually observe.
Okay, so let's break those areas down. Let's start with the lips. What are we looking for here particularly?
So with the lips, we're looking for dryness. We're looking for cracking, bleeding, or signs of soreness there. Dry, cracked lips can be very painful, and often they're an early sign of dehydration or reduced oral intake. Regular lip care can make such a big difference to comfort.
So the common theme here seems to be dryness. It's coming up again and again in what you're talking about.
Yes, and for good reason. So we're assessing whether the mouth looks dry, sticky, or coated, and whether the tongue appears dry or furrowed. A dry mouth can increase pain, it can cause difficulty speaking and distress, and it really can worsen very quickly if it's not addressed quickly enough.
Okay, and are we looking for anything else inside the mouth?
Yeah, so we're also looking at the tongue and gums for redness, for swelling. There could be ulceration or white patches, which may indicate that fungal infection, like I mentioned earlier, that oral candida, which is that oral thrush.
Sure.
We're also looking for mucositis, which can be extremely painful. And this is often observed in people who've had chemotherapy
Okay.
or radiotherapy. And also, loose or cracked teeth can also be problematic, causing pain or actually even a choking risk.
So visual changes are telling us a lot here.
They really are. But we also need to ask. We also need to ask if the person is able to respond as to whether they're experiencing pain, burning, or possibly even an altered taste.
Okay. And I'm guessing dentures are often something that's overlooked. What should we be considering here?
Dentures are such an important part of mouth care assessment. So when we're removing dentures, which often happens more frequently at end of life,
Sure.
the mouth still needs to be cleaned. There's sometimes a misconception that once dentures are out, mouth care is no longer needed,
Okay.
but that's absolutely not the case. The gums, the palate, and tongue still require regular cleaning and hydration to prevent infection, soreness, and discomfort.
And how should we be caring for the dentures themselves?
So, dentures really should be cleaned separately using appropriate denture cleaning products or mild soap and water.
Okay.
Many people actually don't realise this, Leanne, but toothpaste should not be used on dentures
Interesting.
as it's abrasive and can cause microscopic scratches.
Okay.
So these scratches can harbour bacteria, and actually that will increase the risk of infection and irritation. But obviously, this is individual choice. Some people who have been using toothpaste may continue to prefer to do this
Sure.
if it's something that they've always done. Dentures should also be checked for fit, for cleanliness, and also for signs of damage. And decisions about whether to continue wearing them should always be guided by comfort and also, again, the person's individual choice and wishes.
Sure.
Dentures make up an important part of an individual's identity. So it really is important that we respect individual choice there.
Yeah, that's a really good point.
Yeah.
Is there anything else we should be assessing?
So, yes, we're also assessing for food debris, plaque, and thick or dried secretions, which can cause distress and also contribute to infection or aspiration risk.
Okay, so you mentioned earlier that response to care is part of assessment.
Yes, especially for people who can't communicate verbally. So we're looking for signs such as grimacing, pulling away, agitation, or actually vocalization during mouth care, which may indicate possible pain or discomfort. These cues should really prompt us to adjust our approach, perhaps using softer techniques or increasing moisture rather than cleaning.
Okay. And you mentioned earlier that, assessments shouldn't just be a one-off. So how often should we be doing mouth care assessments?
Really, at end of life, assessment should be at least daily and actually often more frequently if problems are identified.
Okay.
It's important, findings and actions need to be documented so that everyone involved in care understands the plan and can provide consistent, compassionate support.
Okay, so it's clear that careful, regular assessment is the foundation of good mouth care at the end of life. And despite its importance, mouth care isn't always done well. Why is that?
Well, yeah, there are several recognized barriers. Time pressures, they're a major factor, as well as lack of training. Some staff actually feel unsure about what products to use
Mhm.
and actually worry about causing harm. Access to appropriate equipment can also play a huge role, but also, we've got to take into consideration patient compliance here. That can be really challenging, especially in our individuals with dementia or delirium.
Okay, and I guess sometimes it's about perception.
Yeah, absolutely. Mouth care can be seen as a basic task rather than actually skilled care, which in fact it requires assessment, clinical judgment, and real compassion.
Okay, so let's move into the practical side of this. What
Mm.
does good mouth care actually look like, and what equipment should we be using?
Oh, that's a great question. Good mouth care at end of life should always be gentle, regular, but individualized.
Okay,
Toothbrushing actually does still remain the gold standard, the
okay.
first choice for oral hygiene, where it's tolerated. And that's even in our palliative care.
And this is where product choice, I guess, becomes really important.
Exactly. And we have a wide range of products available for effective mouth care when a regular toothbrush can't actually be tolerated. So we have something called the 360 toothbrush,
Okay.
which is particularly useful at end of life care. They can clean the teeth, the gums, and tongue, and actually reduce the need for excessive movement within the mouth. They're softer and quicker to use, which is helpful for people with fatigue or those that become easily distressed.
Okay.
We also have our non-foaming toothpaste, which we do prefer to use at end of life. So non-foaming toothpaste is gentler, it's better tolerated, and it's actually particularly suitable for people with dry mouth, mucositis, those swallowing difficulties,
Hmm.
or a reduced ability to rinse and spit.
Okay.
And that's because the reduced foam there lowers an aspiration risk and allows effective toothbrushing using minimal water, which also supports both that comfort and dignity, but also safety
Okay.
in there. And then we have a product for dry mouth where we use something that we call a mouth hydrator and saliva substitutes, which play a huge role, a real essential role. And one product that we commonly use is the MC6 mouth hydrator, which is designed to provide controlled moisture to the oral cavity.
Okay, and for those not familiar, I myself, how is
Yeah,
a
yeah.
MC6 mouth hydrator typically used in practice?
So the MC6 can be used alongside routine mouth care to help maintain moisture and comfort, particularly for people with persistent dry mouth due to medication or oxygen therapy. It's part of a wider mouth care approach and it's designed for safe and controlled mouth moisturing and provides a slow and controlled flow of liquid.
Okay.
Some people also ask about using the MC6 with other liquids, for example, maybe a flavored or pleasant tasting liquid
Mm.
for comfort. We talk about taste for pleasure, and I think this is where the MC6 really comes into its own.
Sure.
So, as long as a liquid is safe, non irritating, and doesn't pose an adverse reaction, it can be used thoughtfully to support comfort.
Right.
Why shouldn't somebody be able to have a taste of their favourite drink
Sure.
at that end of life?
Yeah.
But, it's always important that we're following local protocols and also checking for allergies and sensitivities. The key is about person-centered use. If a taste brings pleasure and doesn't compromise safety, then it is absolutely valuable.
And what can we use for cleaning and removing debris?
So we have something that we call the mouth e-sticks, which is the MC3.
Okay.
And this can be used to clean the mouth using a gentle rotating motion. It's really good for hard secretions, but they should always be softened first with water to avoid damaging fragile oral tissue. So any gel, such as our saliva substitutes, should be applied gently with the MC3 when being introduced to the mouth.
Okay.
It's important to remember that when we are using mouth gels or our saliva substitutes, that they shouldn't just be applied to the mouth and left. The gel really does need to be gently massaged into the oral mucosa. This helps ensure even coverage. It's going to improve absorption and also prevents the buildup of that sticky residue,
Okay.
which can actually increase discomfort if it's allowed to sit on that oral tissue. It's vital to recognize that in the very last few days of life, even these products could become too harsh. So at that stage, it's really about simple mouth moisturizing, which may be the most appropriate approach.
Okay. And I understand that, as guidance changes over the years, there are still some products that people ask about that we just don't recommend. Can you
Yeah.
explain why that is?
Yes, and this is a real crucial safety issue. Pink sponges or foam swabs are not recommended for oral hygiene use anymore.
Mhm.
While they may look gentle, actually they don't effectively remove plaque or bacteria
Okay.
from the oral cavity. So they're actually giving a false sense of cleanliness
Mm.
without actually improving oral health. But more importantly, there's a significant choking risk. The foam head can detach from the stick, particularly when the mouth is dry or the swab becomes oversaturated.
And this isn't just a theoretical risk, is it?
No, unfortunately, sadly, it's not. In 2012, a medical alert was issued following the fatal choking incident of an individual where a foam swab detached during mouthcare and actually caused airway obstruction. So this highlighted the very real dangers associated with their use, particularly in vulnerable patients.
Well, that's particularly relevant in our setting of a palliative care environment.
Exactly. People at the end of life may have reduced protective reflexes, limited ability to communicate distress, or impaired swallowing. So, using equipment that carries an avoidable choking risk is not acceptable when safer alternatives are available.
So the message here is crystal clear.
It certainly is. Foam swabs should not be used for oral hygiene. Instead, we should be using the evidence-based alternatives such as gentle toothbrushing where tolerated, that appropriate mouthcare products that we've spoken about, and regular mouth hydration. This approach prioritizes both comfort and safety.
Are there any other products which are no longer recommended?
Yes, there are. We talk about the lemon glycerine sticks, which historically they were used to stimulate saliva,
Sure.
but actually we now know that they worsen a dry mouth. So the acidic lemon can actually damage enamel and irritate oral tissue, while the glycerine actually has a dehydrating effect,
Interesting.
which is exactly the opposite of what we want to achieve with effective mouth care.
Okay, so we've spoken about the actual physical mouth care. How does mouth care link to dignity at the end of life?
Oh, Leanne, mouth care is fundamentally about dignity. A clean, moist mouth can reduce distress, improve comfort, and allow people to communicate and actually simply to feel cared for.
Sure.
It also reassures family that their loved one's comfort is being prioritised.
Okay. So, as we start to bring this to a close, what is the key message you'd like our listeners to take away from this?
I think really it's so important that we don't see mouth care as just an optional extra.
Sure.
It really is a core component of the care that we give, and it can significantly improve comfort and quality of life in those final days.
Thank you, Tracey, for such a thoughtful discussion. It's clear that this is a topic you're really passionate about, and I've certainly learned that mouth care may seem small, but its impact at the end of life is particularly profound.
Definitely.
Thank you to everyone for listening. Join us next time for another topic.